Hello, and welcome to my presentation on Osteogenesis Imperfecta. My 7-year-old daughter actually has this condition, so I'm always eager to learn more about it. I figured this would be a good opportunity to read peer-reviewed articles in an effort to learn about current research findings that I may not be aware of. It is also an opportunity to raise awareness about Osteogenesis Imperfecta by teaching you all a little bit about it. Because it is very rare, many people have never heard of it. Like I said, the condition is called Osteogenesis Imperfecta. I will refer to it as OI throughout the presentation. It is also known as brittle bones, as fractures are the most common characteristic of the condition. OI is a genetic disorder that results from a mutation in a collagen gene, and varies greatly in severity from very mild, in which a person may experience several fractures in their life, to extremely severe and even resulting in stillbirth, death, or up to a few hundred fractures or more in a lifetime. So looking at OI from a genetics perspective, it is considered to be an autosomal dominant mutation. Often, children inherit the condition from one of their parents, who either has the condition or is a carrier of the mutated gene. In other cases, the child actually becomes a first-generation carrier of the condition as the result of a spontaneous mutation. This accounts for about 25% of the children born with the condition. When a person has OI, there is a 50% chance that they will pass it on to their children. Collagen is an important protein throughout the body, not just in the skeletal system. Collagen helps make nearly all connective tissues throughout the body. I'll touch a little more on this later on. The occurrence of OI is somewhere around 1 in 25,000 people. As I mentioned, OI is characterized by fractures. Children who have OI break easily and often, especially compared to those who do not have OI. Children may experience anywhere from a few fractures to several hundred. Fractures can happen throughout the lifespan, but are especially common prenatally, during birth, and throughout early childhood. Children with OI can even fracture from something as simple as sneezing or coughing, not only from a traumatic fall or anything like that. So this leads us to the question, why do children fracture? Why do these children fracture? According to Borland and Gaffey, altered bone structure due to the collagen mutation results in decreased strength, while predisposing bone to fracture with no or minimal trauma. Type 1 collagen is the most important protein involved with the building of musculoskeletal tissues. When looking at clinical presentation, specific mutations, and diagnosis, OI is broken into groups, or types. It is important to recognize that symptoms vary so significantly by individual that type is not always the best indicator of actual severity, complications, or overall outcomes. So now we know that each person with OI will present differently from one another, but here's a list of some of the common clinical presentations that we see with OI. Skeletal deformity. This is usually caused by multiple fractures. Short stature. OI is actually a common form of dwarfism. Muscle weakness. Laxity in the ligaments. Children with OI appear quite flexible despite their brittle bones because of this. Smooth and thin skin. A triangular shaped face. Blue sclera. This is the whites of the eyes. They actually appear blue or grayish or purplish, and that is because of the collagen disorder. Dental manifestations, also considered, or not considered, but also called Osteogenesis Imperfecta. Scoliosis and kyphosis of the spine due to multiple compression fractures. Osteopenia, a barrel chest, which can lead to respiratory complications. Cardiac complications. The heart actually has a large amount of the connective tissue that is mutated in OI, therefore patients' cardiac health is followed closely. Hearing loss is very common. Thermal instability. Blood vessel fragility, which results in easy bruising. There is also a risk for neurological complications and other issues. This chart breaks down the types of OI. Originally, there was only types 1 through 4, but in recent research and progress in genetic testing, there are now 4 additional types that are recognized. Type 1 represents what is usually considered the mildest form of OI, with relatively fewer fractures than the other types and minimal deformities. Type 1 also usually presents as normal or near normal stature and is the only type that does not result in dwarfism. Type 2 is the most severe of all the types. This chart calls it perinatal lethal. I am happy to be able to report that this is not always the case. I do know of several children and adults that are confirmed type 2 that are alive today. New treatments, which I will discuss next, have increased survival rates significantly in the last decade or two. Type 2 leads to a significant number of fractures in utero and at birth. Because of this, usually the rib cage is compromised, which results in respiratory distress. Respiratory distress is actually the most common cause of death in OI. There are also other severe complications that come with type 2. Type 2 is often referred to as type 3 is often referred to as progressive deforming, as fractures usually result in severe bone deformities. Often type 3 children would not have been able to be ambulatory. They would have used a wheelchair. But with changing times and better treatments, this is beginning to change. The chart shows some more of the specifics about type 3. Type 4 usually presents moderately in severity, somewhere between type 1 and type 3. It says that the appearance is between 2 and 3 on the chart, but this must be an incorrect typo because type 4 is actually milder than type 3 in most cases. Types 5 through 8, they're all different mutations that have various unique presentations. Due to a time shortage, I'm not going to get into those types today. Diagnosis usually comes from a combination of physical exam, medical history, family history, bone density scans, x-rays, and genetic testing. Diagnosis is easy when OI is already in the family because there's no guessing about what's going on. It becomes more difficult when it is spontaneous mutation, however. Diagnosis becomes especially important in regards to accusations of child abuse. It is common for children who are born with spontaneous mutation to be suspected as victims of child abuse before a diagnosis is made. X-rays for child abuse and OI often show multiple fractures at various stages of healing. Also, when OI is unknown, parents usually cannot explain what caused the fracture or fractures. This tends to be consistent when child abuse is the case. Hobbs and Wine say that accidental fractures, especially in infancy, always require an explanation. This may not be possible if the cause is unknown, and if you have a child with OI, you may not know why they're fractured. Because OI is much less common than child abuse, there is a tendency to overlook this diagnosis when a child presents with multiple fractures that seem inconsistent with injuries, especially if a family is unsophisticated, uneducated, and has other social problems such as substance abuse. Physicians may not consider the diagnosis of OI. This was in one of the studies that I read. Zhao and Yan also referred to this issue as a basic lack of understanding about OI, and they were referring to both doctors and parents in that situation. Looking at current treatments. Well, actually, let me go back real quick. I was going to say, can you imagine how difficult it must be to have your child taken away from you as you're being accused of child abuse, but knowing that nobody has purposefully hurt your child, to later learn about OI and find out that that's the reason that your child's been fractured. I have personally seen this happen and just completely turn families' lives upside down. Luckily, with appropriate diagnosis, families will eventually get the support that they need, and the child will receive the treatments that they need. So that's a positive note. Okay, looking at treatments. It's important to know that there is not a cure for OI, but there is a lot of research and hopes are happening. For now, we have drug therapies, most commonly bisphosphonates. This is the same drug family as what people usually know as Fosamax. There are surgical interventions, which mostly include intramedullary rods that are placed inside of the bone to provide support and eliminate extreme bowing and deformities. There are supplements, which usually include like calcium and vitamin D, Please, I want you all to know that OI is not a deficiency in either of these. However, it is important that the bones have at least an adequate amount of both. You have no idea how many people, random people, think that they are saving the day and curing my child by telling me to have her drink milk. Fortunately, that's not the case. If that was the case, she would be healed. Once again, it's just a lack of knowledge. Multiple fractures and other complications lead to both acute and chronic pain, making pain control an important aspect of OI. There's a study that showed that both acute and chronic pain have a strong impact on the lives of people with OI. Physical therapy is also key in building and maintaining strength. Always remember that strong muscles help strengthen and support bones. Some children with OI also require the use of wheelchairs, walkers, braces, crutches, etc. Others are ambulatory when fracture-free. So looking at huge advances in the medical field, I mentioned biphosphonates. Pamidronate, this is a really important drug. I read a whole bunch of studies, and they all showed promise for increasing the quality of life in children, decreasing chronic bone pain, increasing bone density, decreasing incidence of fractures, increasing grip force, and more and more. You can read there. Excuse me. Dr. Glorio said, biphosphonates will probably be the treatment of choice for some time. Fazier-Duval rods, they are an example of the intermedullary rods. They actually expand and grow with the child, and these have really helped children also. I want to finish off with this slide, brittle bones but unbreakable spirits. Every child that I've met, and adult, it's amazing. They go through so much struggle in their life, but they're amazing in their spirit. So I'm totally out of time, and I apologize for going over. I know that was a lot of information in a really short time, so feel free to ask me any questions or for any clarifications. For more information on OI, refer to www.oif.org, that's the OI Foundation, or any of the articles that are listed in my resources. Thank you.